Okay, switching gears right now, we're going to discuss the impact that HIV and AIDS has on the individual, their family, their personal relationships, and then we'll go into some nursing diagnoses um, and to the plan of care. Okay, here is a picture of Magic Johnson and his family. And as we all know, Magic Johnson has been diagnosed with HIV. He's an advocate for HIV and AIDS awareness. And there's just a little quote from him. When I first found out I had HIV, I had to find somebody who was living with it, who could help me understand my journey and what I was going to have to deal with day to day. I found out that a person named Elizabeth Frazier was living with AIDS at the time, and so I called her up and she took a meeting with me. The impact of HIV and AIDS. The impact of HIV and AIDS can certainly impact you, your family, your spouse, any social people that you deal with on a daily basis. But as far as individual and spouses, you can have mental health problems such as anxiety and depression. And depression, because some people look at HIV and AIDS as a death sentence. And it used to be years ago, but through technology and medicine advancements, it's not that anymore. They may reveal aspects of a person's behavior that they may have wanted to keep private, such as infidelity or sexuality, such as male homosexuality or IV drug use. It also results in feelings of guilt, blame, and lead to a relationship breakdown. HIV treatment is a lifelong commitment which requires daily changes to be made. You have your local health departments that you can initially go to for treatment depending on insurances and resources. But initially you can go to health departments just to get you started and to possibly get you to a primary physician and also an infectious disease physician. The CDC reports that the estimated lifetime cost of treating HIV is $379,000, and that nearly 30% of those living with the virus are uninsured. Uninsured, 4 pills per day is an estimated $36,000 per year. So that's a lot of money, for your treatment for this disease. The U.S. is expected to spend $30 billion annually on HIV to help with programs, research, housing, treatment, and also prevention. More than 1 million people in the United States are living with HIV. Many do enjoy a good quality of life, and they can expect a longer lifespan as opposed to those who were diagnosed before today's treatment, like I stated before. Following up with your medical team regularly, starting your antiretroviral treatment ASAP, and taking your medicines as prescribed will help increase life's longevity. Get tested often and also communicate with your sexual partners. According to the CDC, women who are pregnant or planning to get pregnant should take an HIV test as early as possible, before and also during every pregnancy. The earlier HIV is diagnosed and treated, the more effective HIV medicines will be at preventing transmission and improving the health outcomes of both mother and the child. Daily medication usage can help reduce the chances of HIV transmission. Okay, moving on to a plan of care. The first diagnosis that we have here is impaired gas exchange. Outcomes: maintain clear lung fills, unlabeled respirations at 12 to 20 per minute, and your pulse oximetry within normal limits. Nursing interventions: we can do respiratory assessments, have your oxygen as ordered, ADL assist to help decrease the use of your lungs, and also repositioning. Medical management, they may order antibiotics, also nebulizer orders, and also oxygen. And this is just, a limited, it's not a definite plan of care, but it's just some things that your patient that you could be taken care of can go through. And also there are many other different nursing interventions and as well as medical management options. So the next diagnosis is risk for infection. You want the patient to remain febrile and free of purulent drainage or secretions and other signs of infectious conditions. Your nursing interventions can include performing hand hygiene, that's number one. Also monitoring vitals and also isolation as needed. Medical management, antimicrobial agents, colony stimulating factors. And like I said before, there are many others, that's just a few. Imbalanced nutrition, less than body requirements. Maintain weight or display weight gain toward desired goal for your outcome. Your nursing interventions, weight as indicated. Plan your diet with your patient. Provide frequent oral care. And believe it or not, that frequent oral care will actually make the patient want to eat because now they feel clean, their mouth is clean, it's not dirty anymore. Medical management, TPN treatment. That's just one thing that the physician can provide that patient who has the diagnosis of imbalanced nutrition. Risk for injury or bleeding. Outcome, display homeostasis as evidenced by absence of bleeding. Your nursing interventions, monitor for changes in vital signs, administer blood products as needed, assess for change in level of consciousness, and avoid injection. Medical management, imaging studies, XLAP, you will do an exploratory surgery in severe cases, and also coagulation studies. Acute or chronic pain, outcomes, report pain relief or control, demonstrate relaxed posture or facial expression, be able to sleep or rest appropriately. Nursing interventions, provide diversional activities, palliative measures, and give analgesics. Medical management, prescribe analgesics, opioids, and also chiropractic care. Here's a list of some other diagnoses. Here you have fatigue, impaired skin integrity, knowledge deficit, disturbed thought processes, and also anxiety and fear.